Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 113. Oh boy, do we have a treat today. We have with us Dr. Christine Schaffner, who is a naturopathic physician, a graduate of Bastyr University in 2010. She's a founder of the Sophia Health Institute with Dr. Klinghardt, who's actually quite famous. And Dr. Christine loves to treat patients who have seen every doctor under the sun and still have chronic illness and they're not getting better. So these really mystery illnesses, mystery patients come to see her, and she loves to help them recover their health naturally and through education and through lifestyle change and through all these special testing. And she's got tricks up her sleeve that I've never seen other NDs do. So this is going to be a lot of fun. Welcome to the show.
Thank you so much, Ashley. I really appreciate the opportunity to speak with your audience today.
Yes, we were discussing some things before we hit record, and just really interesting, like for Lyme disease, you and Dr. Klinghardt just started using this different kind of lab test, which you wanted to make sure that, as we're talking about chronic illness, you wanted to bring up certain things that, hey, your doctor, if you have Lyme disease, for example, your doctor should be doing XYZ test, and you should be looking for this. And so you have all this great information when it comes to chronic illness. And we definitely want to get into that because I know I have some listeners who are suffering from chronic illness. But first, let's hear a bit about you. Why did you become a naturopathic physician? I'd love to hear your story.
Well, that's a great question, and I can tell you a little bit about my background. I grew up on the East Coast, outside of Washington D.C., and my father is actually an oncologist, and my mother is she trained as a nurse, but she has a background in education, and she was a director at a hospital. So I really grew up in medicine. We joke. I think one of my brother's first words was chemotherapy, right? So we were in this, just medicine was just what, I grew up around. And again, with my father being an oncologist, he's a very smart man, but he was trained very conventionally. And, I grew up on antibiotics, and, food was just not even, part of the paradigm at that point. And I would say, probably in my high school years, I loved science. I always really, had probably an inner knowing that I wanted to go into medicine, but, I just felt that there was something more. And I think in high school, I really developed, this question that was probably in the 90s. So the whole like mind, body, spirit, that was like a new thought. Right. And, I really, was always at the bookstores back then, and, in the, spiritual sections, and just, always asking those deeper questions. And so I didn't really know that naturopathic medicine existed until one of my mother's friends, she was actually going through cancer, and she sought out a lot of alternative medicine, and she exposed me to Bastyr University when I was in high school. And so I, kind of put that in the back burner and was like, wow, that sounds interesting. And then I actually went to the University of Virginia in Charlottesville, and it took me a little bit, I didn't commit to pre-medicine until my second year because I think I was still exploring other options and, just still finding my way. And so I ended up majoring in psychology and pre-medicine. And in my pre-medicine classes, they're really, really rigorous. They're, full of really type A people. And, I was just thinking like, do I really want to go to medical school? Like, this is going to be, I just had the sense like this is going to be soul crushing on some level. And, I have tremendous respect for medical doctors, but it was just not, my path. I was thinking. And so I made the decision, my last year to go to Bastyr. And so that was a big, big decision for me. So I was, in this East Coast, pre-medicine, very conventionally trained, community. And I made this decision to, from their perspective, to go to like a hippie med school. Right. And so I moved across the country in 2003, and um, I went to Bastyr, and Bastyr is a wonderful place. I really admire, our school and what we're doing. And, I think, naturopathic medicine serves such an important need in, the patient care that we need today. And so, but it was culture shock, to be honest, Ashley. It was one of those things where, going from the East Coast to Seattle, it was culture shock. I was, really, everything was new, but it was really, really exciting. And I thought about, should I share this or not, but I'm going to, because it's part of my story. And so, I went to Bastyr in 2003, and I was one of the younger people in the, class at that time. A lot of people, even during that time, it was either a second career or people had been exploring in the world, and then they found their way to naturopathic medicine. And so I actually struggled a little bit my first year in deciding whether or not this was the right path for me. And so I did something that I never had done up until, this point. And I gave myself permission to take a year off, which was, not, I was always really excelled in school, and, that was just, really big for me. And during that year became 2 years. But why I share this is because it really, really clarified and strengthened my decision when I ended up going back to Bastyr. And, during that time, I needed to work, and so I actually got my aesthetics license because I loved skincare, I loved spas, I loved using my hands, and so I did that. It was like 4.5 months, and then I have a dear friend who is like my soul sister, and we went through. This program together. She had just graduated from the nutrition department at Bastyr, and we went on an adventure, and we moved to Colorado, and we moved to Aspen. And why I'm sharing that is because that was so impactful. It's like when you think you're off your path, but you're really on your path, I can always see that in retrospect. But during my time in Aspen, I was exposed to so many exciting things. I, worked in the spa industry, and I, worked at a spa, and being in Aspen, you had to, in my early 20s, I had to have 5 jobs, right, to survive. And so I worked with a woman who put people on raw food cleanses, and, she had an infrared sauna and colonics. And then I actually worked at an organization, a nonprofit called the Aspen Center for Integral Health. And I was helping out, doing some, assisting for some events. And at those events were Dr. Perlmutter, Dr. Ray, these really big names that I didn't know at the time, but I was exposed to these ideas. And, even this woman, she was trying to get funding for her documentary on mercury amalgams. It was called Mercury in Retrograde. And so she, was exposing, how mercury amalgams impacted her health. And, I was then, sharing that information with, like, I remember my property manager. I was like, hey, you have amalgams, you have chronic fatigue, go get this checked out, And so, I had a really full experience when I was in Aspen. And, I also met a woman I'm still connected with today, Julie Levine, and she really taught me about organic skincare. And she has a beautiful skincare line that I still use. And she really taught me the difference between really what is organic, what is wild crafted. So she's an herbalist, and she mentored me a lot in under my understanding of that. And then, we had, it was time to kind of, make a decision about what I wanted to do. And so I made the decision actually to go back to DC, and I studied. I hadn't taken the MCAT yet. And the MCAT is this really tedious exam that you have to do in order to get into medical, if you wanted to go to medical school. So I just wanted to, again, keep my options open. I took the MCAT, and during that time, I actually worked at the American Cancer Society doing some fundraising. And I was really exposed. They have this great, program called Look Good, Feel Better that's really well intentioned, but it was the irony for me. It's when cancer patients actually who are going through chemotherapy, they, of course, it's such an awful experience that they lose their hair, they don't feel beautiful. And so, they provide wigs and makeup, but the makeup that they were providing were, companies that I knew after all this information, like were carcinogenic, and neurotoxic. And I was like, oh my gosh, this is so, the irony here. And so why I share this story is because as I went back, and really said, okay, am I going to go the MD route or back to the ND route? I was crystal clear that, Bastyr was the direction that I wanted to go. And it was all timing. I have this saying I say with patients all the time, trust the timing. And it was all timing for me. And so 2007, my soul sister that I shared with you, we drove across the country, had a great adventure, came back to Bastyr. I met my husband and my best friends within a month. It was just all timing. Things just clicked and lined up. And I really went back to Bastyr with a really renewed passion and love for naturopathic medicine. And I knew when I came back, I wanted to make an impact. I wanted to, really have a career that would be very, successful, abundant, help a lot of people. And so I really kept that intention. And I feel very, very blessed that after graduating, as kind of, fate would have it, I ended up applying for an ad. I didn't even think it was going to be working with Dr. Klinghardt. And I ended up becoming his resident in 2010. And, that was 7 years ago. So here I am.
Amazing. I love your story. I love where there's so many lessons we can learn from it that, sometimes we just need to go with the flow and gain the learnings because it didn't, at the time you didn't think you were on your path, but you were so on your path. Going to Aspen wasn't a detour. It was absolutely part of your journey. And you just were drawn to things that all those lessons you learned while you were working at all those different jobs, you're utilizing those lessons today. Like years later, you're still utilizing what you learned there. And I love that. I've done so many different careers. I also was an esthetician before I was a massage therapist like that. And that was way long ago, like a long time ago. And those things don't seem like it really connects with being a podcaster, for example, or being a health or life coach or whatever. But every single job I've had, I utilize all the lessons that I learned. And so you do the same thing. I love that. It's amazing that, and of course, by doing everything that you did, you gained all the skills so that you could help become one of the founders of the Sophia Health Institute and be the clinic director, which is phenomenal. And Sophia Institute is famous for being an institute that those in absolute chronic illness come to. So you see these really hard cases. I first heard about your clinic a few years ago from my doctor, who we were talking about sort of the geniuses in the holistic world, and I was talking about Dr. Joel Wallach, who's one of my heroes, and I study all of his work. And my doctor said, my naturopath said, oh, well, Dr. Klinghardt is this other amazing genius who, when I send patients to that I have no idea what's wrong with them, and I can't nothing is showing up on the blood, on the labs, I can't figure out what's wrong with them. Within one visit, he has figured out what's wrong with them, and it's absolutely amazing. And she gave me some examples which blew my mind. So I know we have listeners who have some chronic illness. What if they've seen other doctors and they're not getting better, and maybe they feel like they're getting the runaround, and then they should definitely come to you. And of course, the link to everything that Dr. Schaffner does is going to be in the show notes of today's podcast, so you can gain access to her website and the Sophia Health Institute's website. But let's pull back the curtain and talk about chronic illness. What are some of the things that they need to look into that they haven't looked into when they're suffering with chronic illness?
Yeah, Ashley, with, my, with the opportunity with working with Dr. Klinghardt, that's really all I've known, outside of school. And so we, of course, had the great opportunity to create Sophia Health Institute. We've been around since 2012, and we have a really unique and special place where we really see, I think, some of the toughest, cases. And through that, Dr. Klinghardt, what I really admire about him and what we've really, how he's learned is our patients are our greatest teachers. And, he's 66, right? And he travels all around the country, but he's so passionate and committed about seeing patients still. And, he works really, really hard, and we all do. And we all are so committed to seeing patients. And why I share that is because, again, we're continually evolving our medicine. We're continuing to learn, grow. We're always going to conferences. I love inviting experts to come to Sophia or Skype to us and share us the latest information so we can help more people. And so why I share that is because they're, with chronic illness, a typical patient at Sophia, they have maybe when you say, okay, what are your top symptoms? Dr. Klinghardt always says, tell me your top 3, when they really could say their top 25, right? There's many, many things, many systems involved. Our patients have not only gone to very prestigious conventional medical clinics like the, Mayo Clinic and, you have it, or, they've seen a lot of, also really wonderful alternative medical practitioners as well. But I think, where our strength lies and where Dr. Klinghardt's pioneering thought is that we don't just look at one thing. And, it's great to have, a lot of knowledge about one topic, but when you're dealing with the human body, you have to look at many, many different things. And, we're always looking at, okay, what hasn't been treated? What hasn't been addressed? What has maybe been overlooked? Where are the blocks to healing for this patient? And it's kind of detective work, if you will. And so some of the things maybe that I can share with our patients is just, maybe the overview real quick. So we're looking at, any person who comes into the clinic, we look at their health through the lens of a few, I would say, buckets, right? One is chronic infections. So Dr. K is very well known for his pioneering thoughts around Lyme. And so Lyme is not only Lyme, but it's Lyme and co-infections, right? So there are a number of co-infections, but there's also a number of viruses to look at. There's a number of, parasites that are very hard to diagnose, but are often very, very important in treatment. Also mold and fungus, so that, would be the chronic infection bucket. And so a patient might have gone to a top Lyme doctor and done a ton of maybe antibiotics, natural or, medication, but not maybe looked at, parasitic infections or viral infections or, mold. And then we look at environmental toxicity. So we look at not only heavy metals, which, I know most of your listeners probably know about mercury and lead. And, we have a lot of exposures to aluminum right now. And aluminum is very neurotoxic and can inflame the vascular system. So we have ways of diagnosing and treating that. We look at glyphosate. I know that you've had Stephanie Seneff on your podcast. She's a great colleague and friend of the clinics. And when we were starting to learn about glyphosate a few years ago, we invited her to come and lecture us, and she gave us a lot of great information. And, nowadays we actually have a test for glyphosate that's a little bit more specific than the other tests have been. So we were able to document glyphosate in the urine of our patients, which is, rather new. So, we're looking at environmental toxicities. I would also put EMF exposure in an environmental toxicity. I mean, I think that's definitely, it's growing exponentially, and we know the effects on the nervous system and, even our DNA. So that those are the things that we look at, I would say, from an environmental impact. And then, of course, diet is important, lifestyle is important. We look at, I guess I would call this bucket epigenetics. I know that's a vague term, but, maybe a lot of your listeners know that there's a test now called 23andMe, and And that is something that any patient can order themselves. It's a saliva-based test, so you just spit in a tube. And it's one of the least expensive ways to capture a lot of information about your own genetics. And, this is a very new science and an emerging science, and we're always, we're learning every day on how to make this clinically useful for our patients. But there's a number of different programs that we can plug your 23andMe into and then make it clinically relevant. And what that information will tell us is, okay, maybe your patients have heard, or maybe the audience has heard about MTHFR. That's just one, what we call SNP in, hundreds that now we can measure with 23andMe. So we're looking at processes called methylation, and how well can a patient, quote, detoxify. So there seems to be some susceptibilities and patterns in the people that we see and some key pathways to support. There's a doctor, or he's, I guess not formally a doctor, but a naturopath, Bob Miller. Maybe you've heard of him, but he is pioneered a program that we use called DNA supplementation. We like that, but Dr. Ben Lynch is excellent. There's so many great people who are really studying methylation. But why I bring up Bob is because he's actually presented at ILADS, which is a formal Lyme organization that trains doctors, but he is studying people who he sees with Lyme and then their genetics. And so he's coming up and identifying patterns. So that's, really important. How can we individualize, treatment? And then, of course, we look at not only the physical aspect of a person's health, but we look at also emotional, spiritual issues that could come up and give people resources around that as well. So, that's the overview, Ashley. I'm happy to dive into, any topic or, anything else. But that's anytime I see a patient, we're thinking about that. And there's actually one other thing that I didn't mention that I'll share is something I think with Dr. Klinghardt being from Europe, he brings a lot of information from Europe, to the U.S. and to the U.S. to Europe. So he has this kind of global perspective. And we very commonly look at the dental piece, and why I say the Europe connection is because that's a little bit more, I would say, acknowledged or studied in Europe rather in the U.S. But there are a lot of great biological dentists in the U.S. who know this work well. But the dental history has a huge impact on our patients. So we look at issues. We advocate for a metal-free mouth. So do people have still amalgam fillings that we will recommend removing in a very safe and strategic way? If they have mixed metal in their mouth, a combination that can be very challenging for some patients is if they have mercury and gold in their mouth, that can create something called a battery effect, which is electrogalvanism. With the mixed metal, there's a current, and then that can actually increase the mercury that's being released from the amalgam. So we see that be a problem. Root canals tend to be a problem for most of our patients. Root canals are dead teeth. They are essentially the dentist will take out the nerve and then fill it with usually non-biocompatible materials, and that tooth isn't sterile. It actually can have bacteria over time. Root canals are known to produce toxic compounds called thioethers and mercaptans that can have a carcinogenic effect on the body. And then, we also look at something called cavitations or infections in the jawbone. And we can, name this, that we know that either the root canal or the infection in the jawbone is full of bacteria or viruses or parasites. There's a lab called DNA Connections, and often the dentists that we work with will take an extracted tooth or infected jawbone that they're cleaning out and send it to the lab, and we're really always like, oh my gosh, in awe of what's there. There's anything from streps or staph or other bacteria, HPV viruses, different amoebas. And so, even I would say the conventional community understands the health of the mouth is, related to the health of the body, even with heart disease. So we know this can make an impact, on the body. So, I can definitely dive into that topic more. But I'm just introducing, if you have a chronic illness out there and you've tried a lot of things but are not getting better, look at look at your mouth, look at your dental history, and there could be some pearls there for you to explore. I really caution, though, anybody who is going to make you know, um, essentially treat this, you really have to go to a very well-trained dentist. This can be very complex work. It can bring up a lot of things for the patient. So you really want to go to what we call a biological dentist. There's some great websites. I think IAOMT.org. And then I think the other one is IABDM.org. I'll get you that for your show notes. But there's two great websites where most of the dentists listed on, those sites will be very, very capable of helping you out. So.
Right. I've been looking into finding a holistic dentist, and I was reading through their websites, the local holistic dentists, and I'm amazed now that if someone has a cavity, they don't do the standard, drill and fill. They're using ozone to kill the cavity, and it's just the really cool techniques they're using now, so they don't need to put metal in your mouth. Is really amazing. It's quite shocking to hear that we could have parasites in our jaw. We could have infections that we didn't even know about that are over time releasing toxins in our body, which will lead to heart disease and cancer, and also wear down the immune system. If someone is, like you said, has Lyme, then it's all the co-infections that their body's dealing with. Because I know other people with Lyme, and I see some of my friends with Lyme get better right away, and then I have a few friends where it just constantly lingers or comes back. Seems like it keeps coming back. And it's interesting to know they're not dealing with just one. They're dealing with what they need to really do is make sure they're getting rid of all the culprits, and like for example, addressing oral health, and then boosting the immune system so the body can help not have to deal with all the co-infections. Let's talk a bit about the methylation, and so for those that don't necessarily know what that is, or you talk about epigenetics, can you address why is it important to check our genes? Not because things are hereditary, like my eyes are blue, my mom's eyes are blue, but things like epigenetics, where gene processes can turn on and off depending on whether the person is nutrified or not. And what does that mean when you say methylation and detoxification?
Absolutely. And, this is a really, really big topic. And I think, why we even look at this is because, again, as you say, why is some person better and another person, not? Or why is someone responding to treatment and another person isn't? And so this is a way to really individualize treatment. And so and I like to look at this information from an empowering perspective. I know some people still are in that mindset of, oh gosh, I have this gene, I have this dreaded gene, I have this, oh gosh, this is, my fate. But, really, what is, very fascinating and an emerging science is how do our genes interact with our environment? So that's the whole, that's what epigenetics is. So how do we influence our genes so we can have optimal expression? And so, and even, we know it's not only our environment, so how things like mercury or lead or aluminum can actually affect our gene expression. We also know nutrient deficiency, so different B vitamins or magnesium can affect, our gene expression. There's, doctors like Dr. Bruce Lipton talking about the whole, how do our emotions, right, affect our gene expression? So this is a very complex and multifaceted complicated topic where, I think we try to simplify it, but it's really, there's many factors influencing how our genes express. But why we look at this, Ashley, is because it does, give us insights. It gives us direction. It gives us, when we're stuck, we can see if there's any, things that have been overlooked that we can find within the genetic report. And so methylation is a really broad topic, but essentially what it is a methyl group is a carbon with 3 hydrogens, and that is all about biochemistry. Is a very big topic, and it's just how our body communicates, right? And so a methyl group can be moved to different moved around in the body to essentially move certain pathways forward or back. And so, what the outcome is of all of this is methylation is a key process in, making things like glutathione in the body. So glutathione is a phase 2 master antioxidant. It's really important for liver detoxification. If methylation isn't working optimally, one of the outcomes could be, for example, reduced glutathione production. And then that can lead to an accumulation of certain toxins that the body's having a harder time getting rid of. So that's one example. Methylation is also important in creating certain neurotransmitters like serotonin, dopamine, norepinephrine. So if people have any, anxiety, depression, any mood imbalances, there could be, pathways to support around neurotransmitter production. Methylation can also be involved in how we process things like estrogen. So a lot of women are what we call estrogen dominant. And what that means is that they have too much estrogen in comparison to progesterone. And estrogen dominant conditions can be things like ovarian cysts, endometriosis, fibroids. Believe it or not, women should have, non-painful, easy periods, and so if you're not having that, that is, that there's something to explore. There's a reason. And so, that's a whole other topic too, Ashley, right? With all the xenoestrogens in our environment, we're seeing more and more people have, things, they're exposed to things in our environment that mimic estrogen. And so that can also contribute to estrogen dominance. But there are certain enzymes that help us to metabolize estrogen. So if that isn't working well, one's called COMT. So if that's not working well, one of the things that we can look at are, okay, how do we support that enzyme with different cofactors? Typically, that one is B6 and magnesium. So as you can tell, it's a really broad topic. A lot, we're always learning and we're always, trying to figure out how to use this information, but it seems to be really important. And what's exciting is that this is a lot more accessible, that it's more, with 23andMe and technology coming out, tests that would have cost thousands of dollars are under $200 now. So as it's become more accessible, I think the learning curve of how to use this clinically is still emerging. But even over the last, I would say 3 to 4 years, we've made some great strides in how to really use this information to individualize a patient's treatment plan.
That's I love all the information. I can just see 5 more episodes to cover that. So essentially, if we can't methylate, then things like the liver can't detoxify healthfully, and we can't produce glutathione, we can't produce as much glutathione, which is like our number one antioxidant. So then it could lead to cancer, or could lead to chronic inflammation. I'm just assuming that could be sort of, if we can't methylate, then the liver gets overloaded, our body gets toxic, we end up with chronic inflammation. Inflammation ends up can potentially exacerbate conditions, exacerbate chronic pain, can lead to autoimmune issues. So really, it's like, when someone comes to you and they have all these conditions, you want to back it all up and find the beginning and go, okay, where did this all start? And I'd love to definitely have you back to talk about methylation and how we can, if someone isn't methylating, how we can reverse this, or how we treat it, or how we
Mhm.
support the body. What's the best way to support the body? For
Mhm.
those with chronic illness, they should definitely do everything you said. Talk about cleaning up their environmental pollution in their home. I did a great episode on that in the past, and EMF pollution also did a great episode on that, because both are really important. Because if you're in your home, you're sleeping 8 hours a day. Hopefully,
Mhm.
you're in your home probably 12 hours a day, if not 15. And if you're
Mhm.
getting exposed to chemicals that are underneath your sink, or you don't even know that's off gassing, that can be a big problem. Um,
Mhm.
Now, do you have any stories of success that you'd like to share with us? Those who, because it really gives people hope to hear
Mhm.
about someone who was suffering with MS or Lyme disease, or suffering from some unknown condition, and they had all these symptoms, and they went to 20
Mhm.
doctors and they couldn't get better, and then they came to you. Do you have any stories to share?
Mhm. Yeah, absolutely, Ashley. And one of the, why I love this work is the relationships that I make with our patients. And, our patients, it's really, not a sprint, but a marathon, if you will. And why I say that is because typically people, who come to our office, they're not getting better. This didn't happen overnight, right? So they didn't get sick overnight. And so to really, share, like really to reverse a condition, it takes time. And that's always everyone wants to know, right? When they show up the first day in our office, okay, when am I going to get better? And I wish I had my magic 8 ball, to say, okay, you're going to get better in, 2 months, 3 months, whatever it is, And so typically, Dr. K and I often say, give us a year and a half, and, a year and a half, we know we'll make progress. Not that, the process will be over, and that's where it is individual with each one, but really that's we'll make a lot of ground. We'll get to know you. You'll see progress, right? And progress happens sooner, of course, but people notice certain symptoms clearing up, but we just mentally prepare people for a year and a half. And again, this is so individual and cannot be a blanket statement in any way. But I have several stories, but I would say that are coming to mind right now. I mean, one that I can share is there is a pretty popular Lyme celebrity who came to, or celebrity who has Lyme, that came to Dr. Klinghardt, and she's been very vocal about her work with him, and she's still in her process, but she's made a lot of great strides, with the work that we have done. So that's somebody who just comes to mind. And then, one story, and this is a unique story, but I just want to share because it does share with you kind of all the emerging treatment options that are out there. I have a young patient who, she's in her early 20s. She had worked with us for a few years. I would say we got her 80 to 85%, well. And that, that's pretty impressive for, what she had been through, all of her symptoms, when she came, she was so light sensitive that she had to wear dark glasses. She was, you could tell had a depressed affect, really taken out of, her life. And, she's a beautiful young girl. But this illness really had taken a toll on her, physically and emotionally. And so we had gotten her to this point, and then she really, in her heart, really, really wanted to explore stem cell therapy. And stem cell therapy is kind of a controversial topic, but it's an emerging field, especially in our country. We do have more and more access to fat stem cells and bone marrow stem cells, and there's a lot of progress being made for recovering joints. So if you have if you need a knee replacement, like please try stem cell therapy first. We've seen, knees and hips and all of these things repair and regenerate with these types of regenerative strategies. But she really, we're kind of still young in stem cell therapy in the U.S. just because of some of the laws and regulations. But outside of the U.S., there's a little bit more freedom. And so she really wanted to go to India actually. And there's this doctor in India she treats a lot of Lyme patients with different antibiotic strategies, but plus stem cell therapy. And she did embryonic stem cells, which again is a controversial topic, but, which has to be done with somebody who really, really knows what they're doing. And so, but anyway, she did this, and she literally, she had some damage on her SPECT scan, which is a brain scan. And after, she was there for, I think, 8 weeks. After one treatment, for 8 weeks, she was able to demonstrate reversal of her damage on her SPECT scan. And she came, this is why this story pops into my mind, is because she actually, she shared this experience, and she came to the clinic, and she didn't need to be seen or treated. She was just coming by to say hi. She lives in Idaho, so she was actually, going to Bastyr to check out Bastyr to become a naturopath. And she looked radiant, beautiful, happy. And it was just one of the most heartwarming experiences for me. I was like, I just can't wait for all of my patients, to get to this point where they're just coming by to say hi, but don't need, treatment, don't need to schedule a therapy, so that's a unique situation. But I bring it up because, there's with this, patient population, we need a lot of different strategies, a lot of different, experts to continue to educate us. And it's exciting because I think I want to give people hope because, there's definitely the tried and true of what we know, but there's definitely this huge emerging, we're just in the infancy of the ability to repair and regenerate the body. And stem cells seem to have a place. There are other therapies and tools as well out there. But yeah, I think it illustrates really the healing capacity of the body. And, if you're suffering out there, really don't lose hope. There are so many things out there, that are available right now and also yet to be discovered, so I really believe that anyone that I see has the potential to completely reverse their illness, no matter what it's called. And the body has the ability to heal given the right removal of stress and the the correct treatment. So yeah, that's just what popped in my head, Ashley, but I'm sure we have many more.
I love that. I just interviewed Dr. Dennis Courtney, who is in the field, is cutting edge in the field of stem cell therapy. And he definitely was. It was really interesting because he talked about sort of stem cells when they come from bone marrow or fat. If you're older than 20 years old, then there's virtually no stem cells there. And so the best is actually from the cord stem cells from, but he discussed that, and then he said it's all in how we deliver it. And so so I'd be interested to know, do you know the doctor in India, how did she deliver the stem cells? Was it did she do it through the spinal cord? Did she do it intravenously? Do you know that?
I don't know off the top of my head, Ashley. I think it was a combination of IV therapy and local injections. And I completely agree. And, a lot of, patients ask about, okay, can I do stem cells? And I think, as you were saying, Dr. Courtney, it's timing, right? You have to prepare the body too. And you have to, you want the stem cells to be timed when the body can receive them as optimally as possible. So if you're day one, of, your illness and haven't been on the treatment or don't know what's wrong with you, really, get a thorough workup, decrease your microbial burden, decrease your environmental toxicity, optimize your body's ability to detoxify through, epigenetics. And then, after working that program for the time that it needs, then use stem cells, because stem cells then can come in beautifully to repair, regenerate, and heal the body. It's really, really exciting. I'm really excited to see in my career. I know that this will be, a very accessible. Right now, it can be cost prohibitive for people, but with any new technology, that's just how it begins. And then as we, learn about it, there's more access to it. It will become more accessible, to more people. But yeah, no, that's great. I'm so glad that you had him as a guest on your show.
Can you list some chronic illnesses that you like, the names of these illnesses or diseases that you've helped your patients heal?
hmm that's a great question. And most people come to us they say they have Lyme. And I feel like Lyme is just a bucket, for many, many, things that I described earlier, but people will have, everything from chronic fatigue, fibromyalgia, and they will have POTS or postural orthostatic tachycardia syndrome. They will have, other things like, different endocrine imbalances like hypothyroidism. We definitely have patients who have autoimmune conditions like Hashimoto's or even MS. There are neurological, conditions that people will come to us. I would say, of course, one of the hardest neurological conditions out there is ALS. I think Dr. Klinghardt we don't see a lot of ALS, but the patients that we do, um, we're able, I would say, to stabilize and maintain, but not reverse. But I know that that will be possible one day. And I'm hoping, maybe people are out there are doing that I would love for you to interview. Parkinson's definitely can be stabilized and prevented from further progression. And then, other things. I think I named, a lot of them, but it's just like people will say, oh, I have Lyme, I have it, heavy metal toxicity. These things manifest in, many, many ways. And, typical patient has fatigue, insomnia, depression, anxiety, gut dysbiosis, severe constipation, pain, inflammation, that's just kind of our, working, working list. And those, all of those things improve over time.
Amazing. I love hearing that they improve under your care, because I hear such heartbreaking stories when people go to MDs and just get put on drugs and then they end up getting worse.
Mm-hmm.
And so with your care, which is very thorough, they're getting better, and that's great. Dr. Dennis Courtney actually shared this wonderful story about how someone with Parkinson's reversed it using stem cell therapy. However,
Mm-hmm.
he absolutely agreed with you that you can't just use stem cells. Like, this isn't the new penicillin. We're not just, I can do anything I want to my body, go through the drive-through McDonald's and then use stem cells to heal it. No, he definitely agreed with you in that we have to detoxify, we have to support the body's ability to have healthy circulation, and we need to nutrify the body. And he was big on doing that. If as the main modality for healing, and then using stem cells to if the damage is there, right, like
Mm-hmm.
Parkinson's, um
Mm-hmm. Mm-hmm.
or regrowing your own knee joint. So
Mm-hmm.
yeah, it's really exciting. This is all very inspiring to know, especially for those with chronic illness, to know that there is hope. How can someone with chronic illness work with you? Do you do telemedicine, or do they need to come see you in person? What does it
Mm-hmm.
look like to be a patient of yours?
Well, we establish care in person, and so I am available at Sophia Health Institute. We also have a great team of physicians that Dr. Klinghardt is personally trained in, as well as myself. And anyone who's interested in, this approach, I'm confident with any doctor that we have at Sophia, you will be put on the right path. I also see patients. I'm actually going there today. We have a practice in Marin County, outside of California, outside of San Francisco, in the Bay Area, and that's called Marin Naturopathic Medicine. I have a doctor, Dr. Ha Deng, who I work very closely with. She's been working with us and trained by myself and Dr. Klinghardt for over 2 years. So she's excellent, and she also sees patients in LA as well. And then I have another local practice in Seattle. It's called Bella Fiore Clinic, but people can find me on my new website, drchristineschaffner.com, and then Sophia is sophiahi.com as well. So those are some great websites to just get acquainted with our approach and what we're doing out there. And I'm starting, to use Instagram more, and my Instagram is at Dr. Schaffner, Dr. Schaffner. And so I just have a great, I have so many unique and great experiences of the people that we meet and the patients and the conferences that I'm going to. So I'm working on using Instagram to share that more and more.
Awesome. I'm going to have to follow you, like you, or do whatever you do on Instagram. I don't know how you find the time. It's so amazing. I am really excited to have you back on the show. We have so many topics that we can definitely unpack and discuss. Really, I'm very intrigued about your clinic, Bella Fiore.
Fiore, Bella Fiore,
because it is an organic med spa, and which is wonderful, because every time I think about wanting to go for a facial, I don't, because I think to myself, but they're going to use all these weird chemicals on my face, and so to know that there's an organic med spa in Seattle is pretty exciting, and I'd love for you to come back on the show and share what are the things we should look for in our products and our cosmetics to avoid, and why. And I think that's a great topic for another episode. It has been wonderful having you on the show. I'm going to definitely have the links to everything that you do and you've mentioned in the show notes of today's podcast, so guests can contact you. Thank you so much. Do you have any parting words that you would like to leave our listeners with?
Well, thank you so much, Ashley, for this opportunity. And again, I am, so passionate about what I do. And I feel one of the driving things that allows me to work, in the ways that I do is that I just love, I love seeing patients. I love, especially when I see a new patient, and, sharing with them the roadmap and the strategy, and just seeing their whole physical expression change as they feel listened to, heard, validated, understood, and that they can understand that, what's happening in their body, and that this is not a random event or all in their head, but there are reasons why they feel the way that they do, and there are solutions out there. So I think that is just one of the most joyful things about my job. And I just encourage anyone out there who still is struggling to not lose hope, and to really seek out a physician that can really collaborate and hear you, and who is also open to maybe exploring some new ideas and bringing in other methods to help you heal, because that is possible.
I love that point. If your physician isn't open to looking at other things, especially if you're not getting better under their care, then you need to seek out a different doctor, get a different opinion, find a doctor that is willing to work with you and explore many options, and a doctor that's open-minded and willing to learn, one that is your advocate for getting you healthy. So that is very important, is to pick a doctor that's going to be part of a team player on your team, basically. And I know that Dr. Christine Schaffner is definitely one of those people. I'm so excited to have you back on the show. Thank you so much for coming on and sharing this today.
Thank you, Ashley, and thank you for doing all that you're doing to, educate people and empower them. And your show is awesome. So thank you.
Enjoy what you heard today on your episode of the Learn True Health podcast. Did something move you, inspire you? Did you get great information that's going to change your life? Awesome. That's exactly what I'm here to do, is to help you gain your health back. Please turn around and share this. If this is something that's helped you in any way, share this with those you love. Love the Learn True Health podcast and want to support us? Awesome. You can go to takeyoursupplements.com and you can support us that way. You'll get access to amazing supplements that are just really great quality for a great price. And there'll be someone on the other end of the line to help you pick out your supplements that are right for you. That's takeyoursupplements.com. or join our membership. LearnTrueHealth.com/join. That's another great way to support our podcast, support our movement, and you'll be supporting yourself. Gain more information, wonderful videos, wonderful trainings, and you'll also be able to share those with those you love as well. So go to LearnTrueHealth.com/join. Want something fun for free? Go to LearnTrueHealth.com, and right there on the front page, you'll see where you can get our free cookbook. I spent a lot of time making it, and it was so much fun. It's really delicious, healthy recipes. And you can also get our 7-day doctor course. Right there, it's 7 days of naturopathic videos sent right to your inbox, and you can learn from top naturopaths on how to gain health naturally. So that's takeyoursupplements.com for wonderful supplements. LearnTrueHealth.com/join to join our awesome membership, which is only open for a limited time. You can get our free healthy cookbook, and you can also get for free 7 days of wonderful naturopathic videos sent to you. Just go to LearnTrueHealth.com and you'll see it right there on the front page. Thank you so much for being a listener, and thank you for sharing and helping others. Let's spread this information and turn this ripple into a tidal wave.